I'm so grateful for your kind words, Jeff. It is indeed a pleasure and it's an honor to be amongst the elite gathering at Athens for the ESOP Congress and for the Adolescent Health meeting. It's again, as you said, the visa. If I could get my visa for Greece, I would have joined you in person, but I apologize because of some glitches. Being in a third world country, it is a bit of a hassle, and I could not get the visa in time. So I have to present online, and it may not be as effective and probably than meeting you all and discussing the things with you. So as it goes, I'll be talking mostly about the youth and their protection and their rights in the low and middle income countries. The uh, the topic is far too important for us because we in the South feel that adolescents do not get their fair share of uh, care that we need to give them. They are the most neglected part. Just today, I was at the Children's Hospital in a workshop on learning disabilities, and we were discussing that we always look towards the young children, but and then there are adults that we are looking at, but these are the children who are neither taken care of by the pediatricians because we stop seeing them at around 10 to 12 years of age in the hospitals, in the government hospitals, and the adults would not know anything about them till they are 21. So it is a very difficult area. My talk today will be slightly confused again because my topic is on youth and I'm in an adolescence conference, both of them overlapping. The young people, most of the times between 15 and 25 years, adolescents between 11 and 20 years. So, what I'll be talking about mostly is adolescents, some reference to the youth, but more or less, this is the segment of the population which is actually crying for their own identity, and we even do not know what to do with them. As we know that adolescents, they make up for about 16% of the world population. So that's about 1.3 billion. Half of the population of the world lives in low and middle income countries. But because of the population pyramid, the way it is designed, most of the youth actually lives in the low income and the low middle income countries to the order of about 90%. So almost all of the young people are living in difficult circumstances, I must say. And that is why today's talk becomes even more important because when we talk of low and middle income countries, we are actually talking about almost all of the population of the adolescents. So let's see what is the most important thing which we have to look out for. Young people, the most significant causes of death, as opposed to many other times of the world, is the roadside accident. And it is not the roadside accident that we call accident. These are actually because of sometimes, or most of the times, risk-taking behaviors that these young people would do. They are actually engaged in activities which lead to roadside accidents. Infectious diseases in low middle income countries are rampant. And so is violence. This is a period of time with hormonal upsurges. This is the time when they are looking for an identity for themselves. This is the time they're looking for their partners. This is the time when they get into quarrels and they get into fights, and there is a lot of violence. The violence can be directed to others, so leading to murders, but the violence can actually be directed to themselves, that is suicide. So suicide comes as a result of severe depression and the other mental health issues that go unnoticed in these children. So which makes these four leading causes extremely important. Going along, then the diarrheal diseases, again, and infectious diseases, and we should not forget the maternal conditions. Remember, we are talking about adolescent mothers under the age of 20, children getting married and giving birth. So they lead to abortions, unsafe abortions, and others. I'll be discussing them later. And then obviously, HIV/AIDS, drowning, lower respiratory tract infections, and others. I will be talking about in my presentation, I'll be touching 3 or 4 different areas. The first one will be what are the key challenges? Then what are the specific protection problems? Why they are important and what we can do for them. So for the first part, let's see what are the key challenges for young people, especially the adolescents. WHO says that 1 in 7 adolescents suffer from mental disorders. These are mental health issues, including depression, anxiety, and they lead to suicide. Especially when we are talking about the low and low middle income countries, the mental health problems are exacerbated by poverty, violence, and lack of access to care. There are comorbidities. The government is not taking care of them, the society is not taking care of them, and they do not know what to do. So, and along with that, a stigma around mental health issues also, increases the problem. So they are, number one, they do not have any where to go for help. Number two, even if there are places, they are reluctant to go because of the stigma. And resultantly, as we see in our own country, the health care, the psychologists, there are very, very few child psychologists, and there are very, very few psychologists looking after their mental health problems. So it is on the rise in Pakistan as well. And in one study, we can see that almost 1/3 of the students, they were undergoing some mental health issues because of either academic pressure or unemployment or societal expectations and family problems and many, many others. So we don't even explore them in the fullest, let alone take care of them. The other challenge that they face is the economic challenge. The world is recovering very slowly from COVID. The countries that were already marginalized, the poverty index has increased. So, for example, in Pakistan, we had something around 30% of the population under poverty line. Now it's about 40%, and even going further on. And in that, the young people, because of their sensitivities, they are the most difficult to handle. And because of lack of education, lack of job opportunities, there is no vocational training. So they get into informal work and they actually get into conflict with the law. They choose such attitudes and such professions which actually can cause harm. In Pakistan, we have seen that although overall the unemployment rate is not that bad, but for the youth, it is about 10%. Another issue is the sexual and reproductive health issue. Sexual and reproductive health is another area which is ill understood, especially in the context of low and middle income countries. I belong to a Muslim majority country where talking about sexual and reproductive health of young people or of any age actually is meant to be talking about promiscuity, talking about the people using sex out of hands, out of marital sex, which is not allowed in the Muslim society anyways. So then this is usually taken as by the staunch religious leaders as against us, that we are talking about the problem that we are actually misguiding our population rather than helping them. So therefore, the sexual and reproductive health in countries like Pakistan and in other Muslim countries, and I'm sure in the other Christian and other countries as well, there is a lot of stigma associated with it. And because of that, we already have very limited health budgets. The SRH budget is extremely low. So adolescents, number one, there are no services available. And number two, whenever there are services which are available, they are unable to take those services. And so ultimately they are left without it. That is why the sexually transmitted infections, they are on the rise. Because of early child marriage, the pregnancy rates are high, the abortion rates are high, and because of that, obviously there are maternal deaths, as I told earlier, and there are maternal complications. So, and the contraceptive use is also very, very limited, because that is also taken as a taboo in many societies. Now, talking about education and skills, which is in any good country, which is supposed to be an asset. But in countries from the low middle income countries, even providing education and skills is a challenge. The budgets for the education are extremely limited. The quality of education is limited, and there are many areas where there are no schools for post-primary, which is the age from class 5 to class 10 or class 12, where these young children can get education. So although in Pakistan, it's a part of our constitution that every child should be in school till the age of 15 years, we still have 22.8 million children between the ages of 5 and 16, which are out of school, and about 5.5 million adolescents. So we have highest number of out of school children and young people. And this is an impending disaster, because these are the ones who are going to be the leaders of tomorrow. So what do they do then? They resort to substance abuse. Substance abuse is extremely common, again, because of the growing up period is always taken up as a period for experimenting with drugs, experimenting with alcohol and tobacco. But in the low middle income countries, the commercial determinants of health, they come into power. The mafias, the tobacco mafias, the drug barons, they then lead the market and provide these young people opportunities to enter into this vicious cycle. So these children then, because of the lack of awareness and because of lack of prevention programs, this becomes a big problem for them. Pakistan has more than 6.7 million drug users. Most of them are young people. Nutrition and health, another right of the child. Well, not so. In countries, many countries, we have actually conquered the protein energy malnutrition to some extent. The ratio of stunting in Pakistan, however, is still one of the highest in the world. It's more than 40% for young people. But the micronutrient deficiency, the hidden hunger, is the one that affects them most. So, boys and girls, they both suffer from deficiencies of micronutrients. Girls more so with iron deficiency. So these lead to undernutrition, but also, on the other hand, obesity. So this lack of access to nutritious food, along with poor healthcare and hygiene, would lead to more infectious diseases and more NCDs, which we see in the second graph that I showed you about the mortality. So in Pakistan, the nutritional survey reveals that 1 in 8 adolescent girls are underweight, and boys are also stunted, and micronutrient deficiencies are extremely common. And although we have a lot of programs for micronutrient deficiencies for young children, for pregnant mothers, and for the infants, but we do not have any programs for the young people. Gender inequality, another issue where the girls are married off before time, before the age of 18. So they actually lose their childhood early, they drop out of school, and they face gender-based violence. Add healthcare deficiencies to it. So there are more maternal mortalities, there are more unsafe abortions, and there is a lot of violence with the girls. So Pakistan again has a very high incidence of underage marriage, with almost 21% of the girls, and 5% of our girls get married even before 15 years of age. So these girls, then obviously they lead to smaller children, children with complications, breastfeeding is limited, and the care of the newborn, they are unable to do so because they themselves are still unable to do that. So let's talk about some of the protection issues. The rest were earlier, I was talking more about health. Now about protection. Child labor is one of the major areas that we know affects these children. So child labor ratios are extremely high in the low middle income countries. And in Pakistan, we have about 3.3 million children between the ages of 5 and 14 who are engaged in economic activities, more so in the rural areas. Sexual exploitation is extremely common. So worldwide, 1 in 10 girls have been forced to engage in sexual acts. In the sub-Saharan Africa and in other countries, we have the ratios of up to 20 to 30%. And although in Pakistan, we do not have any specific data, but whatever little data we have, sexual abuse, exploitation, and harassment is common not only in girls, but in boys. And in one of the studies from the newspaper data, this particular year, the sexual abuse of boys was more than 50%. Earlier, it was around 40%. Trafficking and forced marriages, as I said earlier, are extremely common. This particular young girl, this is one of our patients. She is 15, carrying a child, taking care of a child, and she herself has been abused badly by her husband and by her parents, the parents-in-law, and she then beats up the child. So, yes, we have about 3 million people living in the conditions of modern slavery, and trafficking is extremely common. The most child marriages are in Niger, and we see that about 76% of girls there are married under 18 and about 28% under 15. Why I bring up this slide, I'll tell you a bit later, because of one of the programs that they are doing, which is helping them. Violence and physical abuse, again, very common. More than 1 billion children, they've experienced physical abuse. Adolescents, homicides occurring very commonly. And bullying is another very common thing in our schools. In Pakistan, we see domestic violence, corporal punishment, and street violence. There is a lot of physical violence in our communities, to the extent that, to some extent, beating is actually taken as a norm. And another new thing that is coming up, and we don't know what to do about is the online exploitation. So we are still trying to understand its perspectives and its dimensions, but unfortunately, we are too slow to learn. And those who are practicing cyberbullying and online exploitation are much faster and much more resourceful. And that is the reason the cyberbullying victimization is increasing day by day. And we are trying our best to handle it, but despite all our efforts, I don't think we are succeeding at any point. Gender-based violence, again, very common. I've already talked about it. And lack of access to health and mental health services, I've already talked about it. Street children, there are approximately 150 million street children worldwide. And these children are exposed to sexual abuse, physical violence, economic exploitation, and whatnot. And there is such a lot of mental health trauma with these children that these children, it is very difficult to bring them back into normal society and into normal work routines. In Pakistan, it is estimated that we have about 1.5 million street children in Pakistan, and they are being trafficked, the internal trafficking, abuse, and neglect. So why is it important? Why are we talking about it? We're talking about it because this youth, and as you just saw, that we have a lot of young people who today are young are going to take on the roles of fathers and mothers tomorrow. So if we don't do anything about them, we are doomed. But if we really help them out, this is the population that is actually going to be our saviors. So just about Niger, I said they've just started a program of scholarship interventions, and that has led to a decrease in the girl marriages. So if there is a will, there is always a way, and we can all contribute to it. In the economic growth markets, we have to look at these people because these are the children of today. If they are properly skilled, educated, their innovations will determine the economic future of the world. So if we have youth-friendly policies there and good employment opportunities, so we can have sustainable economic growths. But if we don't, then the high unemployment leads to brain drain from the country and the economy actually becomes stagnant. Another very important issue in terms of low and middle income countries, especially in sub-Saharan Africa and in countries like Pakistan, is radicalization. So if we don't do anything about these young people, this is going to increase. Human rights and social justice, we know that safe environments, education, healthcare, and freedom from exploitation, every person has a right to it. And we are supposed to give these rights. So it's our obligation to provide them so that they become productive citizens of tomorrow. So they can build a knowledge-based economy. Their health and well-being is important. Nothing is better than a healthy and a well child. And remember, when I talk of a healthy child, I take the definition from Almaty, a state of complete physical, mental, and social well-being. In the Sustainable Development Goals, these are the young people who are going to help us get those Sustainable Development Goals on education, on gender equality, on decent work, on reducing inequalities. So they are agents of change, and we need to work for them. And innovation and entrepreneurship, whenever we have given an opportunity to a young child to think, to do things on their own, they have always excelled. They have actually done much better than what we could have thought. So, last part of my talk, how to tackle these problems. And here I will be talking about these at 3 levels. Number 1, the child and the family level. So fostering a supportive home environment, which is the parental education and support programs, which should be done in the homes, in the communities, with positive discipline, communication, parenting. So Pehchan is my organization. So I'll be taking the examples from Pehchan a lot. I'll be taking a lot of examples from Pakistan. So there we are working on parenting and guiding about protecting issues. Economic support for the families, cash transfers. During the COVID, the cash transfer program of Pakistan was lauded the world over. The Benazir Income Support Program, where we provided this support, and this had saved many lives. And access to health and counseling for children is an extremely important area, and we need to work in the communities. At the community level, we need to have community-based interventions, which will help create protective environments. We need to generate awareness, and community awareness can come through running awareness campaigns in the communities directly, through educating masses, through recognizing abuse reporting mechanisms, and now publishing awareness material on the social media. Pehchan social media awareness messages have reached more than 8 million over the last couple of years. Pehchan has also worked with the government of Pakistan to working on child protection networks and communities in schools and districts all over the province. And we are now monitoring cases and reporting cases of violence against children. Youth empowerment is another very important area for vocational training, life skills education, and leadership opportunities. and giving these young people alternates to hazardous work. This one of our schools is looking after the out of school children and providing them with these education activities. At the state level, we need to work with the governments. We need to advocate for creating robust legal and social frameworks to protect youth from exploitation, violence, and neglect. We can strengthen the child protection laws. We've been working with the government over the past 20 years or so for developing the laws and bringing them in line with the United Nations Conventions on the Right of the Children. So Pechan is now working with the government and also a whistleblower. So National Commission on the Right of the Child has been initiated because of these advocacy issues, and we are now working well with them to develop not only the laws and legislations, but to implement them. We need to work on improving access to education, especially for the marginalized groups, especially the minorities, the disabilities, and the refugees, the internally displaced. And we need to create policies that incentivize school attendance. So these World Bank programs have given dividends. Social protection programs have also been very helpful, and the government in many countries are doing these, and these are bringing excellent dividends as well. We need to strengthen the law enforcement and the judiciary. The organizations like the non-profits can train the law enforcement and judicial officers on child protection issues. And we see that UNODC emphasized the need for improved legal frameworks and law enforcement for combating trafficking and exploitation. So we are working with them, but the key challenge is not legislation, but the implementation of law. So that is where we are lacking, but that is where it is most imperative that we work with the government and we help them to develop mechanisms to monitor the laws that they have framed, they are acted upon. So with this, we can say that we need to work with the adolescents, not with their minds, but we should not forget to educate their hearts. I thank you very much.